Hi, I'm Angela Paxton, and I'm a practice coach and parent consultant for the Indiana Medical Home Resource Team, part of Chip In for Quality, Indiana's Child Health Improvement Partnership. Several of the primary care practices we work with have had success implementing daily huddles. I'm here at St. Vincent Primary Care Center with Dr. Sheila Stewart, talking about her experience with huddles and how they got started.
My name is Sheila Stewart. I'm the clinic director for the St. Vincent Pediatric Primary Care Clinic in Northwest Indianapolis.
Dr. Stewart, who attends your morning huddles?
We have a number of care team members that attend our huddles. We have all of our faculty physicians, our resident physicians, our entire nursing staff, our ancillary staff, which includes our front and back office staff. We have our interpreters, and we have our social workers that attend our huddle.
Dr. Stewart, how did you get started with huddles?
We started with huddles when our first project as part of the Medical Home Learning Collaborative. We chose that because it made sense to us, because the huddle is a method of communication and a method of improving efficiency and workflow. And so that was one of our main goals when we started. We considered that it was easy to gather people. It cost no money because we were already here, and it was a way for us to improve communication among staff members. It is something that I think with a little bit of organization you can achieve a lot of results with.
Any other improvements or benefits you've noticed since you started implementing the huddle?
Yes, the biggest thing that I think that we've noticed with the huddle is that we have fewer issues or items that are missed. That's probably been our biggest impact. We find that we have less disruption during the clinic day because we've identified issues ahead of time before the patient arrives, so that it does not interrupt the nursing workflow or the physician workflow. And that's probably been our biggest progress. So overall, it has really helped tremendously to improve our efficiency and improve our workflow.
Were there any barriers that you needed to overcome?
Yes, there were a number of barriers that we needed to overcome. The first and foremost, which I think is a very realistic barrier that most people will have, is buy-in. Buy-in was a huge barrier because you're asking people to take a little bit of their day and devote it to a specific activity which is possibly new to them, and put it in a formal setting. And that requires a little bit of background work, and it also requires for you to come together at whatever period of time, whether you do it in the morning, the afternoon, or the evening before. It still requires that extra bit of time. So to get the commitment and the buy-in from your staff may be one of your biggest challenges. It was ours initially. Some of the other challenges that we ran into were tweaking, figuring out what was important and what was not important. And so that's a process, as it is with any quality improvement project. So those hurdles will definitely come, but you will work through them, and it will definitely pay off.
And finally, are there any advice or tips that you'd like to share with other practices who want to start huddling?
Yes, I believe that the huddle is a great example of something that you can do where you can start small, and the key is just start. And so, but knowing that as you go through the process, you're going to run into obstacles. There's going to be times that it goes well, and there's going to be times that it doesn't go so well, but you just keep marching forward. And in the end, you'll end up having a huddle process where it's very quick, it's very fast, it's very efficient, and there will be things that you used to have to deal with that you no longer have to say. There's a lot of nonverbal communication that happens now because of the huddle. So I think just get started and keep going and keep working your way through it. It will pay off in the end.
Thank you.